Welcome to Healthcare Algorhythm. I'm Dr. Will Strimel. If you want the real story behind today's healthcare challenges and the strategies and technologies people are actually using to solve them, you're in the right place. Short conversations, clear insights, practical takeaways. Let's get into it. And let's get into it indeed. It's Dr. Will Strimel back here in the Healthcare Algorhythm, and I'm joined today by Stecy Ola. Stecy is a nurse practitioner who specializes in psychiatric mental health as well as social behavioral health. And she's also the director of clinical services for Serene Care Clinics. Stecy, welcome. Thanks for joining us today.
Thank you for having me.
So you work at the tip of the spear in terms of the delivery of mental health services. And I think it's difficult for a lot of us to really understand what your day-to-day life is. So I just want to start out and help us kind of frame the problems that you see and the pain points that you're dealing with. Give us a day in the life of someone who is walking in your shoes and caring for these patients every day.
I like to start by looking at mental health as being a servant to the community. So a day in the life of Stecy Ola in a clinical setting is making sure that we've reached out to the patients earlier, the ones that are coming in and the ones that are not coming in but doing virtual visits, ensuring that their technology is set up properly if they're not going to be there in person, ensuring that they have transportation if they're going to be there in person. So there's a lot of more psychosocial arrangements before the actual visit.
Okay. Right. So access for mental health is always a big issue, and that there's a lot of different avenues that we even have to deal with. It's not just can people even, or are they even willing to come and seek out the services, but how do they access them? So maybe you could start by telling us a little bit about Serene Care Clinics. I think that maybe that's a good place to start, and how you're working on access and what that means in your community. Give us some specific examples of the pain points you're dealing with there.
So Serene Care Clinic started off as a primary care clinic, and in an underserved Baltimore County area. We chose the location, had to make sure we had a bus route right in front of that building and ensure that there was access, first of all, for transportation. But the clinic was open during COVID, so it kind of morphed into more telehealth to adapt to the pandemic era. And so most of the challenges that are meaningful to healthcare that I noticed was telemedicine works, but it's about under what conditions is it working and for who?
Yeah. Well, I'll tell you, so technology adoption is so challenging in healthcare in general, but the pandemic experience was one of those things where we were all forced into it. And there were a ton of lessons learned. And I think a lot of great lessons came from telemedicine, although it seems like particularly payers are starting to dial back on their willingness to engage with that, which is really unfortunate because there's a lot we can do through telemedicine. So you were in a situation where you guys were just getting started, and then boom, now you're into telemedicine. So maybe just give us some of the lessons learned there. I'm sure it was a real baptism by fire.
Definitely. There's no better way to put it. One of the toughest lessons we learned was depending on the age and demographic, as far as education level too, as far as exposure to technology. Patients did not have the right phones for this interaction to be effective. They did not have the right support at home, especially geriatric populations. We have high mentally unstable people who were not able to adhere to their appointments, or for you to be able to truly assess them because of their inability to follow the cues that they need to follow in a visit.
Wow. So how do you solve that? I mean, tell me some things you tried, because this is still a problem today in lots of the technology we develop.
Yeah, so we had some issues where we had to eat the cost of seeing them more than the payer will allow to see them, just so we had more oversight.
Okay. So I actually want to dial down specifically into the one about the phones, where you said, because, and I can identify this with a little bit in something I'm working on, in that we can really develop a lot of great things that can reach people, because almost everyone has a cell phone nowadays. And it's almost, I think we are starting to view mobile devices as an extension of people's sort of knowledge and their capabilities. But maybe, there's still that last mile of the person being able to use it. So can you think of any particular examples, not with names obviously, but but maybe like give us a case example of something that where that cell phone thing was a problem, where you had something, wow, this would really help that person, but this was the struggle, and if there was any solution to it. That's the big thing I want to get to.
We had a patient who was completely against the telehealth. They were just look, it's a foreign language for them. They need to see their doctor face to face. They
Uh-huh.
need to see their therapist. So they were coming to the office, but then as the pandemic worsened, their family member could no longer bring them over.
Okay.
So we had to do tutorials where we were taking their phone and literally having a visit in the office with them, but in separate rooms
Ah.
so that they could understand the workings.
Oh, so meaning you would have a telehealth visit, but in
Mhm.
the actual office,
In
just
the
so you could
actual
kind of
office.
debug the experience, so to speak.
Hmm.
Okay.
It worked out marvelously for this person because I think that the daunting effect of having to pick up your phone and make the audio work and the camera work while you're alone at home, it just wipes that
Yeah.
away because we did it and they returned demoed and then they felt better trying in the next visit.
Yeah, I mean, that's what I wonder is, especially in a practice like yourself where you all are community focused, or are there certain levels within the community? Is it the family members? Who is the right person to pull on to bridge that gap between great technology, but people who just, struggle to use it, whether they're elderly or English isn't their primary language, or they have other disabilities. I think there's a big opportunity to fill that gap, and it'd be great to know
Mhm.
from the people on the front lines what you're seeing that may bridge that.
Yeah, it's really starting off with identifying at the beginning when you have this new patient, like what resources do they have access to? What is their situation? Because that really impacts how their care will be delivered. So if you identify that they have resources, then asking them if it's okay to utilize those resources. Example, your grandchild who's more educated and able to help you with your technology,
Yeah,
but signing those HIPAA forms, because at the end of the day, we're not excused if we break certain laws in the
sure.
process of trying to make things work.
Do you build that into your workflow then, just from the beginning? You realize that with this group in particular, they're going to need a little bit of extra support. So it's almost part of the intake process.
Correct. So the intake team, we work together. We have a workflow that immediately identifies language barriers from the beginning, and there's a workflow for that. There's a workflow for technology barriers. There's a workflow for both. And then we also have a workflow for family support and community support because some people have caseworkers, but they did not even use that as a resource when they were coming for an appointment.
Okay. All right. So yeah, that's good. And do you layer the technology into that sort of workflow? Meaning,
Yes, we layer the technology into it. We want to know what kind of phone you have. We explain why we need to know what kind of phone you have. Do you have people at home that have a different kind of phone? Because we noticed that more people use certain brands of phones, so
Mhm.
they were more familiar with the workings of those phones versus other brands. So that we had a workflow for each type, the two major, of course, an Android and the other one.
Sure.
I'm not trying to advertise,
No, of
but
course.
yeah,
Well, iOS and
yeah.
Android. Those are the two big ones. No worries. Okay, so the mental health, obviously, lots of problems, lots of pain point. I'm sure Serene Care Clinics was founded, or there was an inspiration behind it that led to you all coming together. Maybe just tell me a little bit about your path to that and your personal journey to becoming, working in this field, and then the birth of Serene Care Clinics.
I started out as a family nurse practitioner working with geriatric populations who are in institutions and at home, homebound, unable to go out as often as regular uh, m- people with mobility would do.
Hmm.
So I noticed that there was a huge gap in mental health care.
Okay.
So most of these patients where I was managing their little depression, anxiety, insomnia, but there's a bigger gap. We have large populations of people who have no access to treat their long-term intensive mental health conditions.
Mhm.
So I went back and obtained a extra certification for prescribing mental health. So then I could be able to balance both and identify the need, but treat it. And so Serene Care Clinic became an avenue where a few friends came together and talked about how do we encompass the whole person in one place. So then we
Okay.
decrease the gap because people tend to adhere to convenience better than they adhere to the actual benefit of taking care of your health.
Sure, sure, sure. So it's
Hmm.
it's mental health and primary care
And
in one.
primary care. Hmm.
Okay, and so I guess there's a team involved with that then, right? You tell
Yes.
what's your team look like?
We have a dedicated mental health provider, a dedicated primary care provider. I kind of wear both hats.
Okay.
It became difficult for billing purposes because we had to have NPIs that designated for just primary care and then mental health and other
Sure.
workings. And but there's a lot of finessing. It works out, and then the therapists, we have the option of having in person versus virtual because the younger demographic prefer the virtual
Yeah.
therapist. So then we contract with other therapists outside of the clinic.
So you are finding that there is still a demand for the virtual.
Yes, there is a
Okay.
high demand.
Okay. And do people have to be in your area to access that? Like they have to be Maryland residents, or I'm sure there's licensing.
Maryland. Yeah,
Okay.
I am licensed in 6 states.
Okay.
So there's a possibility of seeing people in different states, but probably 90% of the patients we see virtually are in Maryland.
Okay. So you had this concept. Let's bring mental health and primary care together. Let's wrap a team around it.
Mhm.
What are the big lessons? And I guess it's now the pandemic is 6 years old, right? We're getting on 6 years. So you're 6 years into it. What have you learned?
The first thing is with the payers reeling back on virtual care, it has become a challenge to do, especially primary care virtually, which is affecting the younger demographic who were more comfortable with having their follow ups virtually.
Right.
And we are leaning more towards the benefits of mental health care still being able to do this virtually, but we do a hybrid model where, based on the patient stability, we would do every other visit virtual versus inpatient. So we learned that many patients are able to learn. They're able to adapt to change. It's just about how you unroll that change.
And I think you ask 10 people, we'll get 20 answers to this one. But why do you think the payers are pulling back from it? Because in many, it would seem to be it's a lower cost alternative.
Hmm.
In your population, I don't, maybe you have a sense of the payers that you work with, or I don't know, perhaps given the area that you work in, there may be a lot of state-based or government-based
Hmm.
payers. Why are they pulling back on it?
Beats me really because I've looked at the different reasons they give,
Hmm.
but I feel like evidence does not point towards this being a failing system or a failing approach to care. Actually, is improving
Right.
access to care, improving outcomes, and bridging the gap that was there 10 years ago. But I feel like that I don't know. There might be some other push that is beyond what they're explaining as the reason, and I've not been able to pinpoint that. As far as medical, I would say as a provider, I feel like it's challenging, especially with the presenting symptoms being difficult to assess accurately if the patient is not sitting in your office.
Yes. Yes.
Hmm.
Yes.
Definitely can be a justification. But as far as mental health, no, I don't see that.
Yeah, it'd be interesting to hear the other side of that one, right? Because
Hmm.
when we took it on in the pandemic, we all were apprehensive about it at the beginning, and many people, were afraid it was going to impact the quality of care. And
Hmm.
studies haven't shown that it did. Of course,
No,
a lot of things were
no.
going on at the time, but it really seemed like that was going to be the push that got us over the hump to really start delivering
Mhm.
this more. Um, okay, so back to your day to day life, and I'm sure you're dealing with a lot of challenges, but think of it, in 2026, what are the biggest obstacles, at least in terms of process, technology, things that you're facing right now that you can see solutions on the horizon, or things that really you can say, wow, I wish there was a solution for this one thing.
Um, I think that if there were more apps, which I'm not very tech
That's
savvy,
okay.
but if there were more apps that we could offer patients that came with the EHR,
Hmm.
that would trigger them to know like symptoms of decompensation, exacerbation, so that we could increase meaningful use because most of these patients end up in the ER for things that we could just call in a rescue medication for.
Right.
I feel like we're still missing something there. The EHRs are designed to lately facilitate the provider's life but I'm not sure that we're thinking about the patients we're serving.
That's a great point, right? Because if you think about it, the EHRs, they're not designed for patients, right?
Mm-mm.
And even a lot of the technology that's coming in around in terms of artificial intelligence right now
Mm-hmm.
is it's making a lot of improvements, but it's really focused on more or less the health systems, the providers, because that's what's perceived as the area for reducing costs and saving money and and quote
Mm-hmm.
unquote making money, not realizing that the patients, especially in your area, they're the last mile of the healthcare delivery system, right? And if they're confused and don't know what's going on with their care, then they're not going to be able to do the things that you need them to do, or they're not going to remember your instructions. Um, so yeah, that's a great point. I think we're starting to see a lot of people build stuff around that, but I still think a lot of the things are still focused on enterprise and
Yes.
not as many on patients. Well, I won't get. I was going to ask you what EHR you use, but um, so you're a community focused organization,
Mm-hmm.
but you also like to think with a global perspective. So tell me a little bit
Mm-hmm.
about what you're doing in the global mental health community.
So it's mental health is a stigma in so many countries. It's amazing how many cultures reject the phrase mentally ill.
Mm-hmm.
So going into this is more about, because many of these people end up moving to other countries with this stigma. So it doesn't only affect the global perspective as far as the third world country. Those people will end up being people who move to this country
Sure.
and then they come, yeah, we need to address it beyond our horizon. And the way that we've been trying to do that is pick a few diagnoses. So starting with children, autism, ADHD, anxiety, and try to make it where they normalize looking at it as something that can be helped.
I mean, do you feel that in the developing world that these are even diagnoses that people are even thinking about?
Surprisingly, we were amazed. They have organizations,
Oh,
they
really?
have, oh yeah, psychiatrists are so advanced there, neurologists are working with, but they are limited by culture, not infrastructure.
Ah, okay.
Yeah.
And so, what is the work that you're doing specifically around that?
So we are working with them, like in Ghana, in the Ministry of Health, which is really very advanced because the health minister is actually a neuroscientist and a
Oh,
neurologist.
wow.
So it works out pretty well because he buys into a lot of what we bring. But we're working with foundations that are already creating access for patients who have autism diagnosis. So we're working with them to talk about how to enhance comprehension in the community, collaborate with herbalists. They have traditional herbalists, they
Okay.
have all these different beliefs, encompassing, incorporating, and accepting. I think that's what the thing is, accepting what they believe, but helping them understand that we can put all these things together for a greater outcome for the community.
Okay. And
Yeah, instead of rejecting what they know.
and have you met obstacles with it?
Oh, standard question. The obstacles are so many. It is actually sad because the obstacles even begin at home, like the parents,
Right.
the family members, then the schoolmates, the teachers. So there's a vast field of gaps in learning, gaps in understanding, gaps in awareness. So I think the journey starts with actually increasing awareness. So, like in April, which is Autism Awareness Month, we have a lot of campaigns going on with the university students in Ghana, nursing students, just to make them like create campaigns where they can go out to their little communities and talk about it.
Sure. Whether it's in small towns in, the farthest corners of the earth or Fortune 500 companies, culture is hard to change, right?
It
It
is.
has to
It's a
be a
challenge.
sustained effort and in
Hmm.
people who really believe in it. Well, the work that you do is very difficult. So I always like to get a little bit of an insight is what keeps you going? What is it that you get up every day and you think about, this is why I'm doing what I'm doing. This is the impact that I'm making.
I think what keeps me going is the responses I've had in the past. I don't focus on the negative. I don't focus on the no's because the no's lead me to question what did I not do. So I keep waking up with a renewed inspiration about what else can I do. And every time I get one yes or one smile or one
Mhm.
parent willing to let us do speech therapy with their child, I'm like, yes, that's it. we can't conquer the world. This is not a heroic superwoman thing. No, no, no.
But you can conquer one person's day, one
One
person's
person.
challenge, right? Or you.
Hmm.
Well, that's fantastic. And tell us again just a little bit more about Serene Clinics. I'm sorry, Serene Care Clinics, where you can be found, and if anyone happens to hear that's listened to us today, what they should do to get in touch with you.
Yeah, Serene Care Clinic is in Baltimore County in Owings Mills. We're right on Reisterstown Road. Very accessible public transportation, driving, you'll see it there. We have appointments both virtually and in person. We're a very community friendly clinic, so we welcome everyone, actually.
Well, that's wonderful. Stecy, you're doing amazing work. It's very difficult. Thank God there are people like you who are doing it. And I'm very grateful for the time that you spent with us today, telling about the challenges that you're facing, and hopefully some of these solutions that are coming out to help you.
Thank you so much for giving me the opportunity to have something to say about this, because it's a passion of ours.
Well, it's been my pleasure, and it's also been a pleasure hosting you all today on the Healthcare Algorithm. I hope you'll check in next time for our next episode, and until then, be well.